Selamat siang. Welcome back to another Bali COVID-19 update. My name is Bruce, and this is January 12th, Wednesday. And wow, what a night last night. I'm doing this on the fly because, well, right now my study in there has no power, hasn't had any power since yesterday at 6 o'clock. Huge storms, and that's going to be one of the main stories today. Huge storms up here in Buleleng and around in other parts of Bali as well. And well, our house flooded, and including the third floor here, the wind was so intense. It was 11 meters per second, and water was just coming in everywhere, through every crack in the wall and windows and under the door, and well, my power just blew out and still out. So I'm just putting this together quickly as possible because I'm hoping an electrician will get here soon. Okay, so enough of that. So main stories are the weather, the extreme weather, and the free booster vaccine. So there are three segments on boosters today, and this will be the fourth one because this is the day boosters are supposed to start, and I've been waiting to find out about information about them, how much it's going to cost, where they're going to take place, what kind of vaccines, and so it is all out here now. And so after that, we'll go on to the numbers and the rest, and then I'm going to get back to repairing things and waiting for an electrician and hoping that things get put together here because it is a mess up here, a mess. Okay, first the weather. And what about the weather? Okay, extreme weather, landslides and fallen trees surround Karangasem. And so we've been having terrible weather up here in Buleleng for the past few days. I had 10.1 meters per second on my little machine the other day. So heavy rains and wind have hit Karangasem, causing landslides and fallen trees at several points. And it's the same in Buleleng. However, there have been no casualties or injuries, but property damage amounting up into the millions of rupiah. This was a bad one. A large rock avalanche covered an access road in a village in Karangasem and in Salat district. Nobody again was hurt, but it blocked access to the road. It was pedestrians only. Vehicles could not get through, and it's amazing nobody got hurt. Don't believe in climate change? Okay, come to Bali, the paradise, and see what it is like with extreme weather conditions, because wow, they've been really bad the last couple of nights. Thunder, lightning, heavy rains, heavy winds, trees falling, tiles being blown off of roofs. It has been a mess. Government authorities are urging residents to be vigilant and take care. They're asked to stay away from cliffs and trees when it rains. The goal is to anticipate the unwanted, such as landslides and fallen tree disasters. And so if you are here and you are riding a motorcycle like I do, or even a car, you need to watch out if you're up in the mountains or any of the hilly places where there's potential for landslides, and even on flat roads, like moving from here out towards Lovina. The road is flat out there. There are a lot of trees, and they sometimes fall down across the road, and if you're on a motorbike, you could be squished. Okay, and I'm adding an update to the weather now because, well, it's gone from being an important story to a really important story because, well, I've gotten hit really hard over the last few days, and last night the power went out in the third floor, and water everywhere, just floods. The second floor, the first floor, the third floor, floods, water everywhere, neighbors, roofs flying off, tiles going. It was a mess. It was a mess. And there were some really interesting videos of the main streets here just flooded up in Singaraja, water up to mid-wheel on motorbikes. So the weather is not good. And so if you're planning on coming here and you are going to stay for a while and you're going to go through all the hassles and the risk, and I'll talk about that in the update really quickly, think about the weather right now, because the weather, man, it ain't worth it. And the second lead story here, Jokowi, free booster vaccine for all Indonesian people. And so one of the stories here explains why the government is going to charge people. Well, it turns out that they're not charging people, or not charging Indonesians anyway. President Jokowi ensured that booster vaccinations or third dose for people of Indonesia is given free of charge without any fees. The president confirmed that the vaccinations will start today. He said, "I've decided to give the third vaccine for free for all Indonesians because, once again, the safety of the people is the main priority." Good for the president, because as I've discussed previously, if people were going to have to pay for the boosters, I think a lot of people just would not have done it. And getting it for free, well, that will hopefully encourage more people to get the third shot. The Food and Drug Agency, BPOM, revealed the reason why the government needs to administer a further dose of the vaccine or the booster vaccine. And according to Dr. Penny, who I talk about in another video about this, immunogenicity data from observations of clinical test results from all COVID-19 vaccines shows a significant decrease in antibody levels to below 30% occurring after 6 months of complete primary vaccine administration. According to Dr. Nadia Termizi, we talk about her all the time, the peak of cases is expected to be around the first or second week of February. The indicators for COVID-19 are not looking good for Indonesia as a whole, and I'll talk about that right at the wrap-up update. The head of the Health Handling Division of the COVID-19 Task Force, Alexander Ginting, assessed that currently the increase in daily cases of the coronavirus in Indonesia has not shown a wave to peak at this time. He said the wave will later turn into ripples that float, occurring after 4 to 6 weeks after the holiday. And then he asked local governments to swiftly implement a micro-lockdown if community transmission clusters were found in their environment, especially due to the distribution of the Omicron variant. Good news, everybody is going to get free vaccines, but foreigners. No mention of foreigners yet, and that's B211, says Kita, says Kitap. We don't know where we stand at this point, but it will become clear soon. Let's take a look at the numbers. The 7-day average for new positive cases was 5. So it's gone up, while the 7-day average for deaths is 0. Yesterday's national data shows that the count was new positive cases 802, so it continues to increase. Deaths for total individuals tested for all of Indonesia, 203,706, with a 0.39 positive rate. And the 7-day average is 0.30. So we're going up nationally. Bali tested 40,378 individuals over the last 7 days, and the 7-day positivity rate was 0.08. Bali vaccination numbers, 3,878,356 for the first dose, 85.8% of the population. Second dose, 3,115,922, 69% of the population. 5,474 additional doses were administered yesterday. New cases in Bali yesterday were 9, and recorded deaths 0. So the numbers continue to look good for us, but nationally they do not. There are 4 COVID indicators and 1 positive cases. So positive cases, on the average 404 cases per day now. 2 weeks ago, 136. Active cases today were 4,800, and 1 week ago, 4,300. The average positivity rate 2 weeks ago, 0.07. The average positivity rate now, 0.19. And the national average bed occupancy rate 2 weeks ago was 1.38 and is now 3.35. And so these 4 indicators are not good signs for us. And, well, it looks like we can expect the numbers to go up. I don't have any new numbers today because my internet's not working. Just in addition to the boosters, there is a kind of a poster here that I will put up, and it shows the mix and match for your first and second dose and what is suggested, recommended, or what you're going to be given for the third dose. And let's take a look at Omicron cases in Indonesia. And well, the numbers are going to change by the time I'm ready to upload this on Wednesday, and so I'll put a little update at the end of this. Omicron confirmation cases soar, 414 people infected. So the Ministry of Health has been adding on people as new cases have continued to show up. During December, there were 136 confirmed cases, and in 2022, up until January 8th, there were an additional 278. Of the 414 people, 31 were local transmission, the rest were foreign travelers. And in addition, most of those who were infected with Omicron were fully vaccinated. And because this spokesperson for the COVID-19 Vaccination Ministry of Health, Dr. Siti Nadia Tarmizi, asked people not to travel overseas. And of course, they've been asking people not to do that since, well, for a long time now. She said most of the Omicron cases are from overseas travelers, therefore people are expected to postpone if they want to go abroad. And most of the transmissions have come from Turkey and Saudi Arabia. And Dr. Tarmizi said even if you are vaccinated, you can infect people. So she said this means that the vaccination is not a guarantee that you are not going to get the COVID-19 virus or that you can't pass it on. However, she said, we need to be careful not to get infected. If it's mandatory to be disciplined to apply health protocols, even though they've been vaccinated, so they don't get infected. And the Ministry of Health is encouraging regions to strengthen the 3 T's, testing, tracing, and treatment, and to actively monitor new cases and to immediately notify the center if confirmed cases of Omicron are found in their area. Dr. Tarmizi said, we must not be careless lest the 3rd wave occur in Indonesia. Do not let what happened to India also happen to Indonesia, where in the last 10 days there's been an increase in the trend of cases from 6,000 to 90,000 cases of Omicron confirmation. Despite the increase in Omicron cases in Indonesia, government confident in Omicron response urges discipline. So the government is playing down the threat of the Omicron strain of COVID-19, and they suggest that the situation is well under control here despite an uptick in pandemic indicators. However, they also insist that the public remain cautious and disciplined in carrying out the COVID-19 protocols. And if you remember from seeing previous videos, the numbers were down below 200, and now we've gone over 500 on a few days since then, and the number of Omicron cases are continuing to rise. The 7-day moving average of infections has jumped by almost 100% compared with the previous week, according to Health Ministry statistics. However, Pak Luhut says the government is on top of the situation because the spike of cases is due to international arrivals, not local transmissions. He said that many of them tested positive on arrivals, and from January 1st up until last Friday, there were 790,000 international arrivals, and out of that, 21,000 tested positive on arrival. At this point, it's unclear how many of those cases are Omicron infections. However, despite the increase, Pak Luhut said the number of deaths is under control and the national vaccination rate is rising, and the health system is ready to face the situation. But he cautioned, do not go overseas, and everybody has been saying that, and people are going overseas anyway. Coordinating Economic Minister Erlangga Hartarto said that the government is going to separate data on coronavirus variants recorded at entry points, including air points, sea points, and land crossings, from the locally transmitted cases because international arrivals have been the largest contributor of the upsurge in cases. And Health Minister Pak Budi confirmed that and said that the positivity rate for international arrivals is 65 times higher than that of locally transmitted cases. And he said this has strengthened our hypothesis that most of the confirmed cases were in fact from international arrivals. So we will shift the focus of the health ministry strategies from hospitals to home isolation. Interesting, because most of the Omicron patients will not require hospitalization. So then what happens with the foreigners that come in? They're going to stay in the hotel? Some health officials and experts have attributed Indonesia's relatively low increase in COVID-19 infections down to the fact that 86.6% of Indonesians already have immunity against the COVID-19 virus, and this was revealed during a government serology survey conducted in November and December in 100 cities and regencies. Mastalina Payne of the Indonesian Epidemiologists Association rejected that notion and said that the Omicron variant has the potential to reinfect those already having immunity against COVID-19. She said those that have been fully inoculated and even those that have had booster shots are being infected. So there's no correlation between the so-called super immunity and the Omicron variant. And epidemiologist Riri Sandono Ahmed of Gajah Mada University agrees with that and urges caution in regards to the super immunity concept and said it might lead the public to become overconfident and disregard health protocols. Other countries, she said, were currently struggling to curb the Omicron variant despite boosting higher vaccination rates in Indonesia or having previously recorded higher numbers of coronavirus cases. Even if it's a fact that 86.6% of Indonesians have immunity, would that mean we are protected from the Omicron variant? We just cannot assume that, she said. And so the government is looking on the upside. Should we? Well, you know, I'm working on being positive these days. And so far, the numbers are pretty good. But, well, listen to some of the segments coming up. Okay, what about boosters? The booster vaccine injection starts tomorrow, starting January 12th, paid unless people have PBI. And so this is going to start tomorrow, but according to the head of the Bali provincial office, Dr. Ketut Swarjaya, we've talked about many times before, he's still waiting for implementation and technical instructions. He said, we are waiting. Hopefully it will come out because it's clear on January 12, 2022. And who is going to be targeted for this? It's going to be people over the age of 18. The booster shot is going to be optional, not mandatory, and there's no overall target. It will be given free of charge to people who have PBI health insurance, but other people will pay for it. Will foreigners be given this? Well, that's not clear. Nobody has made an announcement on whether we will be able to go and buy this, because we're going to end up having to buy this. And so waiting for some clarification on that point too. And how much will it cost? No word on that either. The Bali provincial government has received 70,000 doses of Pfizer in order to use for boosting. Other types of COVID-19 vaccines such as Sinovac, AstraZeneca, Moderna are available at the health office pharmacy warehouse. As I mentioned in the following segment, the government is going with the paid scheme because they want to give the public a choice. So you can pick your own, just like picking your own color of shoes or a shirt. And according to Dr. Swarjaya, for vaccine injection sites, such as where the health facilities are, what the price, we're waiting for that from the center. If it's clear, then we just have to go. Okay, so there's no communication going on as usual. And what about the paid boosters? So January, well, this is January 10th. Okay, so boosters are supposed to start on the 12th. Now, I got 2 days until I upload, and so 2 days for the government to actually come out and clarify all this. Paid vaccine boosters provide more options for the public. Health Ministry and Dr. Siti Nadia Tarmizi is there again. She's a very busy woman. She said the government's determined to give vaccine boosters on a paid scheme. Why on a paid scheme? Because she said it gives the public more options. She said people want to pick the vaccine they get, and so by paying for it, they will be able to choose what they want. However, up to now, according to Dr. Nadia, only 244 regencies cities have been able to carry out booster vaccinations because they have not achieved 70% minimum first dose vaccination target and 60% for second dose, and so they have to get there before they can give out boosters. The paid booster plan is not without criticism. A number of civic organizations have criticized this. The director of the Center of Economic and Law Studies, Bima Yudhistira, said that the paid booster scheme can trigger disparities between the lower middle class and the upper middle classes, as many of them still do not have access to the vaccine at all. And he said, Those who get vaccines, especially paid vaccines and booster vaccines, will recover faster and their income will be higher than those who don't get access or have to pay for it. And what are the booster shots that we are going to be able to get, or some of us will be able to get, and we'll find out about that soon. Indonesia approves 5 COVID-19 vaccines for booster shots, and so on Monday, the authorities granted emergency authorization for the use of 5 different COVID-19 vaccines as booster shots, and those will be Sinovac, Pfizer, AstraZeneca, Moderna, and Zififax. I've never heard of Zififax. And according to Penny Lukito, head of Indonesia's Food and Drug Agency, there are also several other vaccines that are currently under clinical trial in order to obtain emergency use permits. The Health Ministry's booster program will be looking at high-risk populations, age 18 and over, especially elderly people and people with immune problems. And what's happening around Asia with the Omicron variant. And so I talked about this before. I said things look good now, but we have to be cautious. Why? Let's take a look at this story. So the one-day COVID-19 tally in Japan has soared nearly 16 times since the turn of the year. That's been 10 days, exemplifying the explosive surge of infections driven by the highly contagious Omicron variant across Asia. And in the Philippines and Australia, all-time records were set. Australia bested the 100,000 mark for the first time on Saturday, as many of you have told me, and thank you for that. The Philippines logged a new record of 26,458 cases for one day, just 2 weeks after reporting fewer than 200 cases. See where I'm going with this? Curbs have been introduced in Metro Manila as well as dozens of other cities and provinces to deal with the surge. India reported 141,986 new COVID cases on Saturday. This was the highest since May. And Tokyo saw 1,224 cases, reaching 1,000 for the first time since September, with a tally 15.5 times that of last Saturday's 79 infections. And so once it takes off, it takes off. So far, it has not taken off here, or we just haven't tested and got it yet. Professor Hideaki Oka of Saitama Medical Center's Department of Infectious Diseases and Infection Control said those with Omicron usually have light or no symptoms and could be going about their daily lives infecting people without even knowing it. The infectivity rate appears close to that of an airborne infection, he said, and he urged the government to prepare for the worst. He said even if the number of severe cases is lower, this is only compared with the Delta variant. It may be as severe as or more severe than influenza, and so this is not a cause for optimism. And as I mentioned in the previous video, the U.S. military is taking some blame for the spread of cases in Japan, and that's a political issue. And in South Korea, the same thing. And the U.S. military has banned personnel from leaving the base to eat, visit indoor malls, bars, clubs, gyms, amusement parks, theaters, and massage parlors. Travel to Seoul is also barred unless for official business. And what about Thailand? Fear cases may hit 20K a day. New cases of COVID-19 could jump to 20,000 a day by the end of the month unless precautionary measures are taken seriously, according to the Center for COVID-19 Situation Administration, CCSA, which I've talked about before. According to an assistant spokeswoman for CCSA, the current situation corresponds with an earlier prediction made by the Public Health Ministry that daily cases may reach 20,000 by the end of January and 30,000 by the end of February. Regarding earlier forecasts of higher fatality rates, the CCSA spokeswoman said that the deaths are still low due to large numbers of people having been vaccinated now. According to information from the Department of Medical Sciences, 5,397 cases of Omicron variant have been confirmed in 71 provinces as of Saturday. The government is hoping to control the situation in 1 or 2 months, although authorities have played out situations where the infection rate would take a little longer to stabilize, and that is another 3 or 4 months. And so, not good news on the Omicron front, except for here in Indonesia. So far, so good. Crossing my fingers. That's an American thing in case it means something obscene where you live. And here's something not COVID related, well, kind of COVID-related. Jokowi wants immediate passing of sexual violence bill. This has been waiting for so long. As sexual assault cases continue to make headlines, President Jokowi has made a public appeal to the House of Representatives to pass the sexual violence bill after it's been languishing for a decade. The bill was originally aimed at providing a distinct legal framework that acknowledges sexual violence as criminal conduct punishable by law and provides protection and recovery for victims. It secured endorsement of the House legislative body on December 8th, 2021. But wait, we're not done yet. The House leadership failed to reach an agreement to table the bill at the last plenary session in late December, citing technicality issues and a matter of timing. There's always a reason that they will not deal with this bill. The protection of victims of sexual violence should be our common concern, especially concerning sexual violence against women, which should be urgently addressed, the president said on Tuesday. According to the Deputy for Politics, Law, and Human Rights at the Executive Office of the President, the urgency of the bill no longer needed to be debated, and all stakeholders should put aside their egos. Yes. And as a response to the president, the Speaker of the House, Puan Maharani, reiterated her shared commitment to passing the bill and reassured the public that it would be tabled at the plenary session after lawmakers return from recess next week. So how long has this bill been around? It was introduced in 2012 by the government-sanctioned National Commission on Violence Against Women, Komnas Perempuan, due to an increase in sexual assault cases. And this has divided the House and the country along ideological lines, despite the fact that there are a lot of sexual abuse cases in Indonesia. The bill gained prominence again after being in limbo for 4 years in 2016 when activists called for legislation to be fast-tracked in response to the shocking gang rape and murder of a 13-year-old girl by 14 drunk men in Bengkulu. Komnas Perempuan and civic organizations also produced a detailed document of academic arguments for the bill, which was submitted to the House in the same year. In a plenary session in 2017, the House approved the draft as an initiative of the House and agreed to discuss the bill. However, the process came to a standstill in the following years due to sharply divided views among lawmakers, and the bill was dropped from a list of priority bills in 2020. Do you see what's happening here? There's just years going by and this is not being dealt with. Lawmakers claimed that the deliberation process was too complicated. And according to this article, at the core of the debate was the resistance from conservative Muslim-based political parties, in particular Prosperous Justice Party, PKS, and individual members of secular nationalist parties who hold ultra-conservative views. Opponents of the bill, get this, say that it has a liberal feminist ideology and it's driven by a Western agenda that contravenes the country's religious and cultural values. The bill was placed back in the House agenda in 2021. However, the bill only covers 4 types of sexual violence instead of the original 9. It doesn't say which 4 or which 9, unfortunately. Of the House's 9 political parties, 7 voted to endorse the bill, while the PKS, of course, rejected it, and Golkar Party requested a delay so that it could be further refined, which is another way of saying we're just going to block it. In the meantime, reported cases of rape and other violent assaults against girls and women soared during the first half of 2021, rising 57% to 1,967 from the same period in 2020. As of 2020, since the bill was first introduced in 2012, there are 45,069 cases of sexual violence. According to a spokesperson for the Komnas Perempuan, we hope the president's remarks as head of state and head of government will encourage political parties which initially wanted to postpone or even reject the sexual violence bill to change their attitude and support the discussion of this bill. Why does this even have to be discussed? Pass the damn thing. And here is a segment on education and vaccinations. Vaccine certificates of Bogor teachers to be collected, official. So the education office in Bogor is going to coordinate with the municipal health office to reschedule vaccinations for teachers for around 10% of the teaching staff that's not vaccinated already. According to an official, there's a requirement of 100% vaccination coverage among teachers in the city before schools could be reopened with 100% capacity. I thought it was 80% myself, and, well, let's see what the rest of this article says. Unvaccinated teachers have to promptly get their vaccine dose, the official said, warning that objecting to receiving the vaccine dose without a valid medical exemption will be penalized. And Hanafi, the spokesperson, said that schools in Bogor had fulfilled the requirement of a minimum of 80% vaccination coverage among teachers and school staff to reopen the school with full capacity. So why do they need the 100%? Okay, I'm confused about this, but that is not an unusual thing in these articles to have figures that contradict each other. Or maybe I'm just missing something. Out of the 3,435 teachers registered in the education office database there, 94.9% have been completely vaccinated. However, and here's another however, despite the high vaccination coverage, schools in Bogor cannot reopen with full capacity as the city is currently under level 2 of activities for PPKM. We haven't talked about PPKM recently. The West Java Education Office has directed schools in Bogor, Depok, and Bekasi to delay school reopening with full capacity until the end of the month. This is another issue of education in Indonesia being badly mishandled. This means that offline school activities will remain restricted to 50% of the total school capacity. We also instruct schools to distribute the school report cards during several periods next Monday. And so that was another thing. So originally, I don't know if you remember this was back a couple of months ago, under one of the PPKM regulations, it said the school reports were not supposed to be given out until January of this year. But my granddaughter got hers in December because they said they've been changed. Who's running the show? And how many shows are there? And this is part of the good and the bad of the regionalization of the government after the fall of Suharto. Everything was centralized back then, and so you knew if it came from Jakarta, everybody was going to be doing it, or pretending they were doing it at least. And once regionalization happened, well, everybody has different rules, and everybody obeys those rules in a different way, and so coordination nationwide is often difficult. On the other hand, we have democracy here. Not the most perfect democracy, but it's still democracy. And currently, we don't have anybody threatening to shut down the government and go against the Constitution, like in some other countries, which will remain nameless. And so while the vacation was going on, the education office was making the most of vaccinating kids, and according to Bogor City Health Office data, around 83,816 children aged 6 to 11, or 82.85%, were given a first dose of vaccine. And Mandalika and Pak Sandiaga Uno are back in the news again. Government says tourist accommodations prioritized ahead of MotoGP at Mandalika. And so Pak Sandiaga Uno said that the government is working on providing accommodations for tourists who will be visiting the Mandalika International Street Circuit, West Nusa Tenggara, in March 2022 to watch the MotoGP Championship. Okay, I know nothing about MotoGP, but it's apparently very popular. The Tourism Ministry has already begun coordinating with regional governments, industry actors, and tourism village operators to provide accommodations. And according to Pak Uno, the MotoGP Championship is our opportunity to innovate regarding the provision of homestays for tourists, as President Jokowi has instructed us to develop an equitable tourism industry. Hence, we also support local homestay operators in operating their establishments, particularly homestays in tourism villages. Great. Great. Spread the money out. Spread the people out, not just in five-star hotels. Wow, it would be great to get some people in homestays because, well, I almost always stay in homestays. But if you're staying in a homestay, well, you could have some problems with transportation, and the ministry is prepared to operate transportation modes for tourists as shuttle from their accommodation to the circuit and other locations on Lombok. Pak Uno said hosting the MotoGP Championship requires not only coordination between ministries and government institutions, but also necessitates collaboration with all stakeholders, including the local community. Yes, get the local community involved. And apart from ensuring the provision of tourist accommodation, the ministry is also committed to empowering the local economy in Lombok and the surrounding islands, the Gilis. Pakuno believes the MotoGP championships will create new job opportunities in both and boost employment in the local tourism sector and the creative economy. And so let's hope so. And that's coming up in March. Let's go to the update and the wrap up. Oh, I forgot about the weather report. And the weather right now is 69 degrees humidity. Wind temperature is 0. 11.1 last night, meters per second. Right now it's 0. Well, if I got out of here and got over there, it's a little windy, but not much. And the temperature, 31.3 degrees Celsius. First, for the update wrap-up, a warning again, I mentioned this in the last video and just reiterate it because more people have been complaining about this on social media. People getting caught with positive test on arrival or in quarantine. And well, there's a lot of confusion apparently about testing and getting out. And so there is a link here that you can look at and see the document in English, and then you can go to the original document as well once you go there and find out. But if you were tested positive for Omicron when you were here, you are going to be in quarantine, additional quarantine besides your 7-day quarantine. So right now it's risky coming here because people have been saying, well, I was okay. I tested negative when I got here and I went into quarantine and they tested me in quarantine and boom, I tested positive. Yeah, that can happen. This is a risk. Right now, traveling is just a risk. So if you don't want to find yourself in this kind of situation, again, I'm just repeating what I said last time. I would not come to Indonesia at this point. So that's the update, because as I said, I don't have internet. And wrap up. This is not as positive, unfortunately, as previous ones. There's not a lot of good news right now, other than the free booster is excellent news because, well, it's going to save people money and encourage people to get their booster shots. As I said, not a lot of good news, unfortunately. Cases are not spiraling out of control yet, although health authorities think that a wave is still coming, that we're not at the peak of the wave yet. We're going to get increasing number of cases, and that includes the Omicron cases. At this point, most of the Omicron cases, the overwhelming majority, are coming from people coming into the country. We do have a lot of people coming into the country. So far as nothing's reported in Bali, that doesn't mean we don't have it here. I would be surprised if we don't. Thankful if we don't. Hopefully I'll have some better news on Sunday. If you found this video useful, helpful, amusing, please give it a thumbs up. If you haven't subscribed, please consider subscribing. And thanks for the comments and the updates about what's happening around the world. Those are useful not just to me, but to people that follow the channel and follow the comments. And so that's it. Thanks for viewing. Stay safe. Be kind to someone today. And I will see you on Sunday.